Hello and welcome to this very special holiday concert and planned Q&A with Chloe Flower.
Hi. Hi, everyone.
Hi, Chloe. Thanks for being with us today.
Thanks for having me.
So welcome, Devoted Health members and soon-to-be members. My name is Leilani. I'm from the Member Experience team. And on behalf of all of us here at Devoted Health, we hope you're staying healthy, warm, and happy as we approach the Christmas holiday this week and New Year's celebrations next week. We're graced today with the presence of celebrated pianist, producer, and activist, Chloe Flower. She's going to play 2 original songs for us on this beautiful glass Liberace piano. She'll tell us more about that one shortly. Chloe's been playing piano since she was 2 years old. She studied at the prestigious Manhattan School of Music, the Juilliard School, and the Royal Academy of Music, London. So she knows a thing or two about this instrument. Today, she composes, produces, and performs music known for its unique blend of classical and contemporary hip-hop musical styles. After our time with Chloe today, we'll be joined by 3 Devoted Health panelists. They'll address questions related to the new COVID vaccines and go over some FAQs, or frequently asked questions, that we get from members. Our guests are Dr. Lindsay Carter, Medical Director of Devoted Health, Will Kahn, a Member Experience Specialist from the Member Experience team, and Maddie Stearns, one of our wonderful member service guides. You might notice that the Zoom chat box for the session is not open. If we don't get to your question during our time together today, we'll go over how to get into contact with a guide at the end of the session. We have guides standing by ready to answer your texts and calls today and every day, we promise. A technical note as well. Since we at Devoted are all doing our part to stop the spread of coronavirus, we're working from home, which means our internet might be slightly spotty. So we apologize in advance for any tech issues. And if audio is cut, we will do our best to fix the situation as quickly as possible. This is the first of what we hope are many enjoyable, informative sessions we'll hold this winter to connect us, have fun, and make sure you have what you need as a Devoted Health Plan member. So without further ado, I'll send us over to Chloe Flower. Thanks again for being with us today, Chloe.
Thank you so much for having me. Guys, I'm so excited to be here and so excited to share my music with you from my home. I'm here in New York City, so happy holidays to wherever you are from New York City. And I'm gonna play 2 songs. This first song is a solo piano piece that I wrote actually during quarantine. I didn't plan on releasing it, but I was just inspired to work on it with everything going on over the summer. And so I ended up just writing this song out of nowhere and we ended up releasing it. So I'm really excited to share that with you because for me, music has always been a form of therapy, not just education. And I think that in the medical industry, it's so important to embrace music, not just for passive listening, but also for mental health and for any type of health. So I'm excited to share this is like a piece of me with you. And my second song is Carol of the Bells. It's a rendition that I did with Babyface. He rewrote the lyrics and we wanted to make it more modern. So we added some beats to it. And so I'm gonna play those 2 songs with you on the Liberace piano. So this glass piano, I wish you could see the whole thing, but if I move it, I'm afraid like everything is gonna get messed up, you know, on my Zoom, but everything perfectly mic'd. But it's made out of thousands of glass pieces, and Liberace used this piano to tour all the way up until he passed. And so I'm so grateful to the Liberace Foundation and Estate. They loaned it to me. So I have this here in my apartment and you're gonna get to hear it. So thank you again for having me, and I am going to move my mic and perform for you shortly. I'm back. Okay, so this is Flower Through Concrete, and this is a solo piano piece I told you about earlier. Thank you so much. I'm gonna play one more song for you before I go. This is like a trap Christmas. So either you turn your volume down because there's gonna be a loud beat, or you turn your volume all the way up like I like to do. And feel free to dance and sing along, although we changed the words, but you'll hear. And again, thank you so much for having me. This is Carol of the Bells, trap style. Thank you guys. Thank you so much. I can't hear anybody, but I feel your energy and I feel your Christmas spirit. So thank you so much for having me.
Wow, thank you, Chloe. That was incredible. Hearing music is such an important part of getting to the holiday spirit for me, and I bet a lot of you listening in feel the same way. So thank you, thank you. And as a reminder, if you want to hear more from Chloe, please go to devoted.com/member events. That webpage has her YouTube and Spotify information, so you can keep listening. So thank you again, Chloe. And now I'd like to turn our attention to Dr. Carter. Dr. Carter is the medical director here at Devoted Health and a primary care physician. She received her medical degree from Harvard Medical School and her MBA from Harvard Business School. She's been practicing medicine for 8 years and also teaches at Harvard Medical School. She's going to talk to us about the new COVID-19 vaccines and go over some questions she's heard from members and patients recently. Hi, Dr. Carter. Thank you for joining us today.
That was a hard act to follow. Why did I have to go next? Kidding aside, that was so incredible, Chloe, and just like made my day, week, month, year. So thank you so much for sharing. It was so incredible. I know everyone is really excited about the recent news about the COVID vaccine. There really is now light at the end of the tunnel. I also know that the vaccine brings up a lot of questions, and so I was hoping to address some of those today, some of the basics on the vaccine, and answer what I've heard are some frequently asked questions. So first, is it safe and is it effective? The results are actually incredible. At 95% effective, the vaccine has been shown to be incredibly safe with really few side effects. By way of comparison, the flu vaccine every year is often only about 50% effective. So this 95% is just unlike anything we've ever seen. With any vaccine, it's common to have symptoms like fatigue or headache after you get it. That's your immune system reacting in a good way to the shot. And the side effects that we've seen in the vaccine trials are very similar to what we've seen with other vaccines. In the COVID vaccine studies, up to half of people reported really mild symptoms like fatigue or headache, and fewer than 5 out of every 100 people reported things like a low-grade fever or swelling and redness at the site where they received the shot. These side effects typically go away on their own within a day or two, but when you get the vaccine, be sure to call your healthcare provider if you have any side effects that bother you or that don't go away. In terms of safety, I know people have expressed concern about the speed with which this vaccine was developed, and I assure you that the vaccine was studied rigorously and no shortcuts were taken. The reason it's been developed so quickly is because of the incredible coordination and cooperation really across the whole world. We've really never seen anything like it, and it's a testament to what we can all do together. I hope you've been able to see that as healthcare workers and our country's leaders have started to get the vaccine in the last week, it's all been going really extremely well, and we expect it will continue to do so. Last, I know there's some concerns about the new technologies used for the vaccine, so I just wanted to briefly explain how this one is a little different from the usual vaccines that we're used to. This vaccine does work in a slightly different way. The typical way to make vaccines is that you take a piece of a virus, you either weaken it or kill it or snip off a little piece of it, and that's what's injected into your body. And your immune system reads that and develops a response. So if you ever were exposed to that virus in the future, your body can fight it off. The 2 COVID vaccines that are currently approved use a new technology called messenger RNA. And it works not by injecting a piece of the virus, but instead by telling our cells to actually make a piece of the virus. And this small piece of COVID that your body then makes can't make you sick, but it's enough to help your immune system learn to protect you if you then come in contact with the real virus. So it's a really incredible new technology that we're super excited to be able to use now. The second area I know people have a lot of questions about is when and whether they should get the vaccine. And so we are rapidly learning more about when and how the vaccine will be distributed. As you know, it just started less than a week ago. Each state is receiving shipments and has a state level plan on how to distribute it in waves. We know that healthcare workers and people who live in long-term care facilities are in the first wave and are currently receiving the vaccine. The CDC, Centers for Disease Control, recently came out recommending that the second wave be people over the age of 75 and frontline essential workers like teachers, factory workers, police and firefighters, grocery store workers. We expect to hear more on that second wave very soon, as I know many of you will fall into that wave. The third wave will likely be people between the ages of 65 and 74. And anyone who's over the age of 16 with a medical condition that would put them at a higher risk of complication if they were to have COVID. So things like chronic heart disease, chronic lung disease, diabetes, just to name a few. The hope is that most of the population would be vaccinated by the fall of 2021. And we expect that details about all of these waves and how you would get it locally will be made available at the local level, again, depending on what the local vaccine supply looks like. So be sure to contact your provider to find out more. We will also be trying to find out more and updating our website with that information, but your local provider is really the best source of those details for you. Currently, the only people who are recommended not to receive the vaccine are those who have had a serious reaction to any of the components of the vaccine itself. And the components and ingredient lists are actually available widely online now. The other piece to note is that if you've had a serious reaction to any vaccine in the past, it's recommended that you speak to your provider to find out and decide whether or not the COVID vaccine is safe for you. Just one side note, it's available now for anyone 16 and older, and studies in children will be beginning soon, but currently only available for those 16 and older. One other question we get is, I had COVID, or I think I had COVID. Should I still get the vaccine? And right now it's actually recommended that you do get the vaccine. We think about 10% of the people actually studied in the COVID vaccine trials had actually had COVID before, and it was safe for them. And the current thinking is that that extra immunity that the vaccine would provide will be good. But of course, please always discuss your individual circumstance with your healthcare provider if you have any questions. I personally am encouraging all of my patients to get it as soon as they can, and any of our members who call in and have questions, the same. But I just want to note, it's important that even after you get it, it's critical that we continue with masks and social distancing. This will unfortunately be a part of our reality until a large portion of the population is vaccinated and the numbers are under control. But there really is a light at the end of the tunnel. And we're so excited and so happy that this has happened so quickly for all of us. Last quick note to mention, because people are asking about coverage. This is covered under Original Medicare, so that means it's $0 to you, which is great. Turn it back to Leilani.
Thank you so much, Dr. Carter. I know we're all so eager to get this vaccine so we can see our loved ones again and have fewer people suffering from COVID-19.
Absolutely.
Yes. Since we'll all be home for a little while longer, let's turn it over to Will to learn about how to make the most of your benefits from home. Hi, Will.
Hi, Leilani. Hi, everybody. So great to have you all with us. So let's take a moment to chat about using your benefits from the comfort of your home. So the first thing we've been hearing from members is about gym benefits and what to do if your local gym is closed. We know you want to stay fit while we're all stuck inside at home. So let's talk about your options, okay? With Silver Sneakers, that's the benefit with Devoted Health, you can do virtual classes and get fitness boxes shipped to you. I mean, like, that's really cool. I'd want that. So our guides are ready to help you with this. All you need to do is send the words Silver Sneakers to our texting number, which is 86685. We'll see your text. We'll send you the phone number for Silver Sneakers for you to call and get set up. The second thing I hear from members is, how do I get over-the-counter or OTC items safely? I've got some really good news for you. You can shop for over-the-counter or OTC items online from the comfort of your own home and avoid searching for these items in person. All you need to do is go to devoted.com/OTC and enter the details to find your catalog. All of the links you need are right there in the catalog, and you can access them right from the comfort of your computer. Just a heads up, with the holidays in full swing and everyone staying at home and getting more gifts for their loved ones, shipping is just a little bit slow right now. But really, don't get me wrong, it's still a great option, and I'm already seeing shipping getting better. So order early in January to get your items soon for 2021. And the third thing that I hear from members is, how do I get a Devoted Dollars reward? You'll find that things are a little different in 2021 than they were in 2020. So for seeing your primary care physician in 2021, you will get one reward for your annual visit and one reward for your seeing your primary care physician within 90 days of your effective date with Devoted Health. So for those of you that are watching, and for those of you who start with Devoted Health on 1/1/21, welcome to the Devoted family. We're really excited to have you. You will need to see your primary care physician before March 31st, 2021 to be eligible for that reward. So book that first checkup with your PCP soon. Another change I wanted to let you know about is that we've also doubled the rewards for getting your flu shot next year. That's super exciting. So with all of that, I want to share some really helpful tips about when to expect your reward to come in the mail. After you attend your first primary care physician appointment early next year, or when you do your wellness visit with your PCP as well, or even when you get your flu shot, right? The claim can take up to 90 days to get to us. It's just paperwork, sorry. But we will get it, and we will get your rewards in the mail as soon as possible, as soon as we get that eligible claim. And we'll send that to you by mail. So please make sure that your address on file is right and that you're reading your mail so that you don't miss your Visa prepaid gift card. You can learn more about this at devoteddollars.com. And I just really want to thank you all for being part of the Devoted Health family. I hope you have a great holiday. Be safe. Back to you, Leilani.
Thank you, Will. Those were some really great tips. And speaking of rewards, we know that a lot of you have already gotten your flu shot this year, which is great. But we've heard some people ask, is it too late if I haven't gotten mine yet? I know we're coming up at the end of December. Dr. Carter, what do you say?
Definitely not too late. Definitely encourage everyone to get it when they can. We often see flu activity sometimes even into April of a given year. And so it's definitely not too late to do it. We do encourage people to do it as soon as possible, this month or in January if you can, but definitely not too late. And please, everyone, do it. It's more important this year than ever.
Thanks, that's good to know. And now we're in our final segment already. We have Maddie, who's going to talk about a couple more questions that she sees day to day as a member service guide. So hi, Maddie. Thanks so much for being with us today.
Hi, thanks, Leilani. Thanks for having me. So something that we hear from a lot of members is that they're not sure how to find providers like a dentist or a PCP, your primary care physician. So to search for local options near you, you can go to devoted.com/search-providers. It's really easy. Just type in the doctor you're looking for, like dentist, and your zip code to see who's closest to you. From there, you can give the dentist a call and schedule an appointment. And while we're speaking of providers, sometimes we hear that new members call to make an appointment once their plan starts, which is fantastic, but the office doesn't know that the providers accept Devoted Health. It seems strange, but it can happen since providers interact with so many different plans, and every year Devoted Health has expanded. So if this happens to you, please don't panic. Just let us know and we'll help you get it straightened out, especially if you live in one of the areas that Devoted Health is new in 2021, Ohio, Arizona, San Antonio, Texas, Orlando, Florida, and Jacksonville, Florida. Again, if you live in these areas, your providers are new to Devoted Health too, and sometimes this can cause confusion. But we promise you that the PCP on your ID card, it's listed right on the back, accepts Devoted Health plans. They just might not know it yet. And if you don't have it yet, your welcome kit with your ID card will be on your doorstep soon if you haven't received it already. And finally, I just want to remind all of our lovely members that we're here to help you and make sure that everything is set for you. So please just reach out to us if you have any questions at all, or if you want to confirm that your PCP is in the network. Thanks so much, everybody, and happy holidays.
Thank you, Maddie. So those are some of the common questions that we see day to day, but if you have questions specific to your plan or your care, please let us know by texting our guide team at 86685 or giving us a call. Our guides, including Maddie, will be looking out for your texts all afternoon. So even if you don't have a question, please feel free to say hi or let us know how you felt about today's session. We have recorded this session as well, so if you want to listen again or send to a friend, please go to devoted.com/member events, and you'll see the recording there by 5 p.m. tonight. Devoted.com/member events is the same website we'll post information on about our next musical guest. So please keep your eyes peeled. And thank you so much to all of our lovely panelists who joined us, and especially to Chloe for her beautiful music. On behalf of Devoted Health, all of us, happy holidays, stay safe, and talk soon.